Phyllis Brown. I was born in 1932 on a farm in Darlington, Maryland. I was a smoker for 60 years. I was sitting in the chair watching television, and I got this really weird feeling under my left arm. And I thought, what is going on? Maybe if I stand up, it'll go away. Well, I stood up, and I ended up on the floor. I had plugged up my aorta. When they were going to do the surgery, they did a PET scan, and they found that I had a cancerous lesion in my lung. And the doctor there said that he was sending me home. I had 3 months to live with hospice.
So when Mrs. Brown came to see me, she was newly diagnosed with lung cancer, and at the time that she was worked up to see if the tumor had spread anywhere, unfortunately they found a brain metastasis that needed to be assessed and treated. Typically when patients come in with brain lesions, they have several options. If it's a small lesion in an area that's easy to get out surgically, oftentimes a neurosurgeon will go in there and resect it, and then we could potentially do radiosurgery to the postoperative bed. However, most of the time, patients that come in are either too old to have surgery like that, or the lesion is too big or in an area that's hard to get at surgically. And that was kind of the case with Mrs. Brown. She really didn't want to have surgery, and so we discussed an alternative to that. And when you talk about radiation, you either have standard radiation, which is radiating all of the brain, even though there's just one lesion there, and that oftentimes unnecessarily damages the brain tissue. And so then we really focused on radiosurgery on the novalis, and that's how she came into our department to talk a little bit about that.
I had smoked for 60 years, so I just took it. You go when your time comes. But there's somebody somewhere, probably upstairs, that makes machines, like treated me and helped me and gave me more time with my family.
We were able to deliver a very high, precise dose of radiation to her brain metastasis and had excellent results. And when I last saw her, her brain lesion was completely gone on the MRI, and so she's quite happy with the results of our therapy.
Number one, Dr. Volpe was so caring. And Joe, it's absolutely amazing how you're treated here. And when they showed me this bed, you just lay there. Because I'm extremely claustrophobic, and I just can't do the machines where you have to go in it. So it was the thing to do.
So I think what's interesting with Mrs. Brown is that, to me, she epitomizes the type of patient that we like to cater to here. If you're specifically looking at her case with involvement of the lung and the lymph nodes, many patients, even 5 years ago when I would see them, would say, you know what, I'm not going to do chemo. Low dose of palliative radiation makes no sense to me, and they just kind of go on and let things run its course. And I think this is really a change in the paradigm now, that this technology gives us a much different way of looking at the disease process and taking patients on a case-by-case basis. This is really kind of a new hope for them. It's not going to work all the time, but it does work most of the time, and this is a great case of that. The tumor's gone in the head, and also all the normal brain tissue around the targeted area has more or less been spared.
After my first treatment on the brain, I was able to go to my granddaughter's field hockey game. Every day gets much better. I was really tired after the lung treatments, but I'm up to the point. I'm making apple butter, jelly. I cooked, I don't know how many dozens, probably 200 dozens of cookies to give to the neighbors, and my daughter's children will love them. At San Diego Radiosurgery, my experience was phenomenal. You would come in, Joe would greet you, always give you a hug, tell you the truth, and then you would see Dr. Volpe. And basically, we didn't talk too much about my treatment. We talked about all of his diplomas hanging up on the wall, his children, his wife, who was a pediatrician. So it was a fantastic experience.